Irritable bowel syndrome is a highly prevalent disorder of the gut, characterized by abdominal discomfort and pain associated with altered bowel habits. So today, Dr. Paulo is in studio to discuss this health challenge and the potential use of fermented turmeric as supportive therapy. Paulo, good to have you with us again.
Hi, Michael.
Now, let's talk about IBS as such. I mean, what are the causes of this condition?
All right, the causes are not known.
Okay.
It is not due to structural abnormalities of the gut.
Right.
So if people that have structural abnormalities of the gut, either because they were born that way or due to surgical procedures, they may experience similar symptoms, but that is not called IBS. IBS occurs or presents itself with patients that have a normal or structurally normal gut.
Okay.
There are a number of hypotheses, however. One of them is environmental factors, so everything related to stress. Inside the gut, there are a few options. So you're looking at reduced levels of digestive enzymes, for example. All right. You're looking at even at reduced levels of steroid hormones, such as testosterone. Mm-hmm. This is a case in point. So all patients with diagnosed IBS have very low testosterone levels. All right. Certain foods will also play a role. That's typical. Even foods such as carrots, for example, that we believe shouldn't elicit a reaction, abnormal reaction in anybody.
Plain vegetable.
Yeah. So that points to a dysfunctional immune systems and a dysfunctional digestive process.
Okay.
So in other words, the digested food reaches certain parts of the gut in a coarser form, if I can put it that way. Right. So it hasn't been properly digested, completely broken out into its constituent forms, so that the immune system reacts against it.
So could you say that IBS is a dysfunctional gut to some degree?
It's a dysfunctional gut, which is brought about by internal conditions within the gut that are not optimal, as well as external conditions that affect the gut. Okay. So primarily the central nervous system is involved together with the gastrointestinal system.
Right. So what then would the symptoms of IBS be? What are we looking at?
The typical symptoms are abdominal pain, cramps, flatulence, and then both diarrhea and constipation. So altered gut function, as you mentioned.
So it's a couple of different things which are also associated with other issues, but would be the cluster of these symptoms?
It's a cluster of these symptoms.
IBS.
That's how we call it a syndrome.
Okay.
It's a cluster of symptoms. Syndrome basically means we don't know exactly what is happening. Yeah.
Okay. So then how would we be treating IBS as such, because we don't know exactly what it is that we're dealing with?
But right, because we don't know what it is, there is no targeted treatment. So if you consult Dr. Google, for example, all right, you will see that there's self-help method. So that has to do with increasing the intake of fiber, for example, because the intake of insoluble fiber will increase the transit time. So it'll make sure that the digested food or the leftovers from the food, so to speak, in the form of stools will go through quicker through the system. Rather soluble fiber will benefit the gut microbiota, which are also one of the challenges in IBS. So a dysfunctional or a disproportionate number of specific bacteria in the gut. Then they also suggest that you do relaxation techniques, reduce the level of stress, because stress is believed to play a very important role in the development of this condition. Okay. In terms of pharmaceutical drugs, of course, treatment is supportive and symptomatic. Right. So the drugs used would be laxatives if you have constipation, anti-diarrhea if you have diarrhea, all right, antispasmodics if you are experiencing cramps. But none of these address the causes of the problem.
And then are there specific foods, because obviously the gut, it's mostly, a lot related around food. So are there specific foods that would help to relieve or I don't know, take the edge off this IBS? Yes,
so there's a group of foods known as FODMAPs. So these are short chain carbohydrates that are fermentable within the gut, and they induce stress in the gut or rather for susceptible individuals. Okay. So basically you should avoid these foods. You can Google a list of such foods to be avoided, but the ones that one should then take include lean meats, for example, eggs, leafy green vegetables, fruit with a low sugar content, as well as fermented foods that have already been fermented.
Right. Now there are specific studies that demonstrate the positive effects of turmeric on IBS. And we've spoken variously about turmeric products like curcumin and things like that, but how does turmeric specifically help with IBS?
Well, in terms of studies in 2022, there was a systemic review done of a whole lot of population studies that had been done previously. The systemic review found that turmeric improves the intensity of the symptoms of IBS,
Okay.
and therefore it improves the patient's quality of life.
Okay, so it's kind of mellows things down,
Yes,
if we wanted
yes.
to call it that. So now you mentioned fermented food. So fermented food is known to be generally helpful
Yes.
for the gut. The FODMAPs you said are fermentable food. So how would fermented turmeric, for instance, be beneficial even further than just taking in turmeric?
All right, so you've highlighted the difference between foods that are fermented prior to being taken and foods that are fermented within the gut.
Mm-hmm.
Okay, so fermented foods are foods that are fermented before you eat them.
Right.
So fermented turmeric would have been fermented before one consumes it. So those fermented foods, it is found that such foods, such as fermented turmeric, their bioavailability is increased.
Okay.
Okay, the digestibility of the food is also increased,
Right.
as well as their antioxidant activity.
Okay.
So all of these are benefits of fermented foods
So could you
in
say,
general.
could you say then that fermented foods are almost pre-digested to some
yes.
degree?
Yeah,
Okay.
to some degree, quite right.
Okay. Now, fermented turmeric, we've said, would improve IBS symptoms. What else might this be applied to in general in the body?
Oh yes, it can. So in the gut, for example, for patients with Crohn's disease, ulcerative colitis,
Right.
patients who are trying to eradicate Helicobacter pylori, that is the bacteria that causes more than 95% of stomach ulcers.
Mm-hmm.
Okay, and then outside the gut, obviously turmeric is very beneficial for inflammation, for joint pain, for liver support, for
Okay.
diabetes. Yeah.
Right. So, Paulo, if we can just create a bit of a distinction. So we've spoken about curcumin as a supplement, and now we're talking about turmeric
Yes.
and fermented turmeric specifically as a supplement. Are they the same thing? How different are they?
All right, so curcumin is one of the substances within turmeric.
Right.
So turmeric contains curcuminoids, okay? And one of these curcuminoids is curcumin.
Right. Okay.
Okay, so you can have a product with just the curcumin that has been extracted, okay, or you can have a product with all the curcuminoids in, and even a product with the entire turmeric root in, for example.
Okay. Okay.
So the fermentation process, what it does is that it reduces the curcuminoids to a different form, which makes them more bioavailable.
Okay, okay. So, Paulo, into our Real Health Medicine cabinet this week, we've put fermented turmeric. This is a product from Terra Nova, brought in by Phytoceutics. What makes this an option for what we're talking about with IBS?
Well, firstly, Terra Nova is probably one of the top brands in the world in terms of ethics and in terms of their mission and how they put their products together. The fermented turmeric in this product is known as Turmeric.
Okay.
It is produced by another company, okay, that only produces fermented substances.
Right.
They don't sell directly to the public, they sell to supplement companies who then incorporate these substances into their products.
Okay.
Okay. And this Turmeric has been tested, and it has been shown that it has all the effects that we have described. So it improves the symptoms of IBS, all right, because it has a higher bioavailability and a greater digestibility.
Okay.
So it plays a role in all the benefits that we've just been speaking about.
Right, right. And I mean, Paulo, is it possible to get enough of these compounds and things from daily foods? I mean, if you had to go home and ferment turmeric, would you be getting the same quality or intensity or what the word would be? The volume of the compounds that you would...
That's an excellent question. So the difference here, companies that specialize in fermenting foods, such as fermenting turmeric, for example, they have developed, which they then patent, they've developed the fermentation process that gives rise to the highest levels of the substances that must be there at the end.
Right.
When one does something at home, yes, you will have some of it, but you have no way of controlling the system and coming out with a recipe that gives you the exact same result every time. That is the problem. Yes, it's like not every orange has the same amount of vitamin C.
Yes,
okay.
Yes.
So what they've done here as well, another very important thing, not just here, but even if you ferment at home, remember that to ferment, you need to introduce bacteria into the plant.
Yes.
The bacteria do the fermentation. Once the fermentation process is complete, especially in this case, once they know that it must only last so long,
Yes.
or it must only achieve certain parameters which they can measure as it is happening. Then the bacteria are inactivated,
Okay.
but they remain in there.
yes.
Their dead body, so to speak. Okay?
Right.
They remain in there, and they are now classified as parabiotics.
Okay.
And they have also a positive effect because you ingest it
Yes.
with the fermented food. They have a positive effect on the gut, on the barrier function on the gut. They assist us with immunomodulation on the gut. So that's just a bonus effect of the fermentation process,
Okay.
especially a fermentation process that is done correctly.
Right.
Because it's very important that the correct bacteria are chosen and that those bacteria are not accompanied by any cousins that are pathological,
Okay.
which can happen if you do it under home conditions, for
Yes,
example. I'm
yes.
not saying it should not be done at home. I'm just saying that at home you have no way of making sure that everything is sterile and you only
Absolutely.
have what you want into the mix.
Yeah. And Paulo, then in terms of this kind of product, is it safe for everybody? Any sort of conditions we should be aware of if engaging in
No, this
these?
is safe for everybody.
Okay. And where is it available?
I believe it's available in health shops and pharmacies.
Wonderful. Paulo, thank you as always. Very interesting conversation.
Thank you.